So the task that we're going to be breaking down today is Will is going to be our 17-year-old calf rubber who has some right ankle pain. So what we're basically be doing is first we're going to break down what he needs to do to perform calf roping. One of his main complaints was getting up on the horse, and he leads with his left foot into the stirrup. So basically, to get up on, the horse would be on this, his right side. We're going to pretend this is the stirrup. So first we're going to need to have sufficient knee flexion on the left side, or as well as sufficient more than 90 hip flexion, as well as greater than neutral dorsiflexion to then plant our foot into the stirrup, while our right side is going to have sufficient neutral dorsiflexion, full knee extension and full hip extension. Then when they lean into and start to bear weight through the stirrup, even greater hip flexion and greater hip extension, about 5 to 10 degrees of hip extension here. And then it's going to be a little bit of a hop on the right side. So we're going to go into that right ankle plantar flexion greater than 60 degrees. Once they're planted and getting up on the horse, they're probably going to be grabbing the reins up here, so plenty of shoulder flexion to about 90 degrees and elbow extension, as well as hip external rotation on both sides and some trunk lateral side bending while they're balancing on that left leg to swing around on top of the horse. So the movement, planting with the left foot in the stirrup, pushing off of that right leg, getting external rotation of both hips, at least 45 degrees of external rotation on each side, slight lateral side bending, and then plenty of hip abduction on both sides to get into the horse or onto the horse. So the functional test to break down the task of getting onto the horse, we're going to first have a gait analysis, just because with his complaints of his ankle, I want to see how his ankle fares while just walking plainly, and if he has any compensations. The next functional test is going to be a squat, analyzing, because when he's on top of the horse, he's going to be in a squatting position. I want to see how he normally squats. And then also to work on his, or to challenge and assess his ankle mobility and balance would be a functional Y balance test. So first, Will, do you mind taking off your shoes for me, please? And if you could just walk down to that first table and back. Here I'm looking at his ankles, his knees, his hips, any trunk swing. You can come on back, seeing how his foot works while touching the ground, and just analyzing if he has any compensations due to that right ankle injury. Now, if you could turn around again for me, please, and I'm going to have you squat. Just squat how you would normally squat. And again, seeing how he squats, seeing the ankle mobility, the knee mobility, hip mobility, how well he balances. If you can come back up, any strength deficits, and also going to see it from the lateral side. If you can squat for me again, and come back up, and one more time from the front. You can squat down and come back up. Good job. Just analyzing how well he squats. He needs plenty of range of motion at throughout the lower extremity joints to squat, as well as sufficient strength that we can analyze. The last test, is if you can throw on your shoes for me, is going to be a Y balance test. So our affected joint is going to be our right ankle. So when Will stands, I want him standing on his right ankle, and just watch me real quick. Just reaching that left leg as far forward as you can, far back to the left side, and as far back to the right side. And we would be measuring how far he gets it. So staying on that right ankle, squat out, good. Back to the left side, 45-degree angle, good. And right side at a 45-degree angle, great. And that would help measure his ankle stability as well as mobility on a single leg stance. Now the exercises that we are going to be doing is first working on that ankle stability, just strengthening it. So Will, if you can sit on that table with your ankle facing my way. And this is just going to be an ankle four-way with a TheraBand. So I would wrap it around the top of his foot and have him pull your toe towards you. Great. We would start off with 2 sets of 10 in each direction. So that's one direction, pull into the band. It's another direction. We're gonna have you point your toe. Great, and then one last direction. Pull it out to the side. Great, and this would help work on Will's plantar flexion, dorsiflexion, eversion, and inversion. The next exercise that I want him to do is working on a single leg stance on the foam. So if you can just stand on the foam with your right foot. We're just going to stand up, and what we're going to be doing is I'm going to be guarding him, but we're going to go for 3 sets of 30 seconds on each foot. Just again, working on that single leg stance and trying to balance. All right, you can relax for me. The last exercise to progress, working on that ankle stability, is going to be a small plyometric. This is going to be in the late stages of rehab, but since he does have to jump up on that right foot slightly, what I'm going to have him do is we have little boxes, and we're just going to have him hop back and forth. We're going to start 10 times forward and back, and then 10 times side to side. So good. Relax, and then just hopping side to side with that same foot. Good. And you relax, and again, maybe 10 times to each side, going for 3 sets. And this would be in the late stages of rehab when we can do plyometric and we're sure that the tissues can handle it. The next set of exercises are going to be a squat variations. So Will, can you come over here for me, please? We're going to do somewhat of a just a sit to stand on the chair, but Will, if you can sit down first for me. We're going to do 3 sets of 10, but first I want you to stand up, and then when you sit back down, just hover your butt over the chair. We're going to go for 8 seconds of hovering, and relax, and just sit back down into that chair. One more time if you can do it. Sit back down, working on that core stability, that quad stability, focusing on the ankles, and just have a nice isometric, and then relax. Good. So to progress that, since the horse is going to be moving and we want him to have stability in that squat position, we would use a Bosu ball. So just getting on the Bosu ball, performing a squat, and then holding it. We're going to do 3 sets of 30 seconds. Good, and just squat down for me. That's plenty. Good. So when you squat, hold it right there for me. Hold it, hold it. Good, and then come back up. Again, 3 sets of 30 seconds. So for the last variation, last progression, if you can face towards the wall, still on the Bosu ball, we would have blaze pods so that while he's riding the horse, he does have to keep his focus up to where the calf is going. So if you can assume that holding a squat position and then touching out the blaze pods as they come out. This is challenging his core, his hips, his ankles, his knees, as well as his attention, so focusing his cognition. All right, you can relax for him. Good job. The last progression of exercises, working on single leg mobility. So what we're going to be doing here is some single leg stance toe taps. So starting and going around to try and tap this. This is also going to focus more towards what our Y functional balance test was. So Will, if you can come up, starting on your right foot and starting to the left, going all the way around. Good, good. And we would do 5 rounds, so 5 sets of going around for each leg. Right, you can relax for me. To progress that, we are thinking about how he is getting up onto the stirrup. So using a stool to then first step up, go up as if he's stepping up, and then slowly coming down. Up, and slowly coming down. You can go up, start on your right side. Up, slowly coming down. One more, up, slowly coming down. Great. And we would do 2 sets of 10 for each leg. To progress that, we are going to then take something more of like a medicine ball, a light medicine ball, and he's going to do the same thing, holding this, and when he steps up, he's going to push up his arms out in front of him. Good. Up. Good. One more. Good. And then can you do one more on the other side? It's his left foot that normally gets into the stirrup, so focusing on stepping up. He's also helping out with that left foot and helping out with the right foot, and then bringing that right hip up, which would simulate getting into the saddle. Good. All right, you can relax for me. So that is the breakdown of how we want to have Will get up into his saddle and hopefully prepare him for his calf roping championship.